CAR-T therapy is very interesting. I hope you have followed the publications now at this year's EHA. We have also seen very interesting abstracts at this year's ASCO last week and last year's ASH meeting in December. So there's a lot of new studies being presented and new constructs being shown and new indications with the known constructs. I think in general, what we observe is this year is a very important study from Great Britain, actually, in lymphoma patients with a bicistronic CAR. So the difference to the CD19 CARs, which are in use already, is that this is not a CAR against only one antigen, is targeting two antigens. In this case, it's CD19 and CD22. And these two single chains, so the antigens targeting domains, are on one vector. So the cells, the T cells, are transduced with one vector and then express two different counts. And this is a strategy to overcome the antigen escape by treatment. So if you target two antigens, you might reduce the number of cells surviving due to antigen escape. This is the well-known and described strategy for cancer cells. And the results presented by these groups are really very promising. I can't say too much because it's not presented yet, but you will see a very interesting result. And this is new, it's upcoming, it's investigator-initiated. It's also a new production they use. It's an on-site production system. It's half automated, so it's not so costly, I would think at least. And it's very interesting. And we have these data for BCMA CARs for multiple myeloma. There's many studies ongoing, and the results become more and more mature. So this is interesting. We also have data from Axicell, which is also already licensed for aggressive lymphoma in indolent lymphoma, now presented here with very promising results, actually. So very high response rates and much better tolerability than we had seen it with the aggressive lymphomas. This might due, on the one hand, to the different biology of lymphomas treated. So the aggressive lymphomas might be more difficult to treat than the indolent lymphomas, on the one hand. But also, I think this reflects the progress we have made in the meantime with supportive measures in these patients. We use tocilizumab, for example, earlier than we used to do. So this ameliorates the side effects, and obviously the treatment becomes safer. So what we also see at this year's EHA is that more and more of these patients reported here are now being treated on an outpatient basis, which is certainly completely new, at least for us here in Germany. All patients must be treated as inpatient, but it becomes clearer and clearer over time that most patients will not need observation for 2 weeks because most patients will not suffer from severe side effects. So this is all new, this is what's going on, broadening of the indications for the established CD19 CARs, new production methods, and new entities like multiple myeloma, so acute myeloid leukemia. So this is all very interesting, and I hope, I think so, and I hope that we will see these new constructs presented at this year's EHA soon in the clinics then as well.